Good morning, afternoon rather. Today, I'm going to discuss about depression. Last week, I discussed anxiety, stress, distress, and coping. So, in line with that, we should talk about depression. A lot of people kind of, understand or have heard something about depression from the news or seen it in themselves or other people that they know. So depression is defined as a major medical disorder that affects our mood. That means our internal emotion, our cognitive, which means our thinking, and also physical symptoms like back pain. We have different types of depression. And why are we actually talking about depression? World Health Organization actually said depression is one of the most uh, disability disorder that causes disability in the world. A lot of people are living with depression, and a lot of them are actually not receiving any treatment. We have different types of major depression. Uh, One that is called premenstrual dysphoric disorder, the one that follows ovulation for women and usually resolves a few days after the menses started. Uh, Other depression can be due to medical condition, and that is why a lot of people who are older, 65 and above, they are screened for depression. People who have suffered myocardial infarction, people living with diabetes, high blood pressure, taking medication for a long time. There is depressing to have to live with condition that you don't have any control over. And also another one that is called seasonal affective disorder, like during the time that we're in right now, the winter period. Some people have experienced depression during winter time. And we also have a depression called peripartum depression that occurs during pregnancy and even 6 months after the delivery of the baby. How do we explain depression? Said depression usually uh, uh, basically has two causes, like biological, that is genetic, and environmental. So we can have biological risk factors like our brain, our neurotransmitters, our psychological values like the way we think, our learned behavior, or people who are very pessimistic, who don't see things will get better, things like that. And then if you have those risk factors, then you have a stressful life events like loss of job, or you are working in a job that you are not happy with. You they go into feeling like there's no hope, hopelessness, worthlessness. They are being refused. Like people who have business, you apply for something, a job, and you are being refused. That can lead to people getting into depressive mode. Then, if you have those stressful life event occurs, then the stress hormone, like we said, genetics activates. The stress hormone activates all those various hormones in our hypothalamus, and we have elevated level of cortisol, which kind of affect our neurons and damages the neurons. So that might make people be feeling. That's why the cognitive, like making people feel foggy, depressed, and all that. Then the negative thought patterns, that's the psychological, like people start having when stressful life events occur. Some people who go into depression, have negative thought patterns, like they are thinking of death, they are being pessimistic, there is no way out of this, I should give up, and things like that. And another aspect that can contribute to depression within the stressful life events is lack of social support, like people who don't have friends because of their difficulty in interpersonal relationships, like having difficulty with their marriage, with friends at work, and things like that. So What are the signs of and signs and symptoms of depression? We want to talk about this to help, in order for us to help our loved ones and also ourselves. If we see these symptoms, we notice or we're experiencing this type of symptoms, so that we can seek help. One of them is shopping spree. Like we hear about retail therapy. What does that do for people, which is temporary? It's like improve your self-esteem or create a distraction for what you are feeling. Number two is drinking heavily. A lot of people, they said, text says that high percentage of people who are depressed try to cope with their anxiety by drinking alcoholic beverages. Another sign is, like I mentioned, feeling foggy or forgetfulness. Other signs are like excessive internet use. Like we all, right now that there is COVID-19, we are, forced to use the internet. But some people, even without COVID-19, they are always on the internet, which might lead them into going into porn sites, game sites, or be on online community. Not that it in itself is not it's bad, but when you are using those excessively, you prefer to be online than have one-on-one contact with people. That's signs, symptoms. Other things is binge eating or obesity. We see people who are depressed on either side of that. Some people binge eat, like in a period short of time, they eat a lot of food and gain weight, or people lose weight. They don't have appetites and all that. And another thing that the text talks about is shoplifting, which we can see that also in the mood disorder, like bipolar. Like shoplifting kind of create a power or a feeling of importance. It might give them like a rush to counter their the feeling of numbness. The physical symptoms that I mentioned earlier on is a lot of people develop back pain, that they don't have back pain before. As depression deepens, they complain of physical pain like back pain. Then also risky sexual behavior, like some people have, typically people have low libido uh, with depression, but some people use sex to cope with their depression, so they might get into risky sexual behavior to cope with the depression. Other signs or symptoms is exaggerated emotions, like that they show little emotions or too much emotions, like being irritable or have explosive behavior, like being agitated, loud, yelling and things like that, or becomes sad, like sadness that doesn't cannot the patient doesn't the person doesn't feel like they can get out of it, hopeless, or feeling guilty, that is overwhelming guilt. And another thing, the last one I'll talk about, the sign is not taking care of oneself, and that's one of the reasons why they do screening for even older patients, because when someone has depression, they might not take care of them in terms of when you don't deal with the depression, they might not follow their medical care, taking their medications because they have lost hope, like they just give up on themselves, up to even not taking care of their physical needs, like taking a good ADLs, performing good ADLs on themselves. And how do we take care of depression? Because there's one big thing for depression. Our priority is safety, because we need, a lot of people who have depression, they have greater risk for suicide. So we need, as nurses or family members, we need to assess for risk. Like if someone have access, because number one, if we meet someone who is in our care and they have depression, we need to ask directly if they have any thoughts of hurting themselves. So we need to ask directly. And what are do they have access to, like ammunitions like guns or medications? If they say they have thoughts of killing themselves, if you ask them, do you have any plan? They can tell you about their plan, and we need to find out if they have access to their plan. We need to listen to patient and not judging, non-judgmental. We need to help them reassurance and give them information how to get help, even our family member how to get help, and whatever they are dealing with, we can give them information. If it's job trainings, learning new skills and things like that, and encourage them to seek professional help or self-help themselves, like things they can do for themselves. We're going to talk about some of the things that treatment. We want to promote communication, like making our communication therapeutic, something that is beneficial to our patient. We don't want to challenge their beliefs or condemn their beliefs. And also, well, if some of those, everything else doesn't work, of course, they're going to be on medication like antidepressants. And also psychotherapy, very important. There are different types of psychotherapy that can be utilized for depression. One of them is interpersonal therapy, which is interpersonal relationship therapy. Focuses on individuals' relationship to kind of look at their relationship, their roles, and how it's working out. Then there another therapy is called cognitive behavior therapy, which is to help them to identify and link their maladaptive thinking patterns and behaviors, and usually have plans and how to exchange some of those maladaptive thinking and behavior for new ones. And also we can have like a family focused therapy that will eventually also include the family, to get them to sit down to talk about the issues at hand. And if they are in they can also, whether they are in patient care, like in patient care, like in a hospital, or even as outpatient, they can go to group therapies where they meet with, there's a person like a psychologist, a nurse, or advanced practice nurse that kind of moderates that group therapy, where they talk about the issues at hand and learn from each other how to cope and things like that. And another management of depression that we found like people use are called complementary health approaches, like omega-3 fatty acids. I'm not sure about research on that, but those are things that people use. St. John's wort, and other things like bright light therapy, more for seasonal affective disorder, like during this winter season, or you live in Alaska where you don't have enough bright lights, then they can prescribe those. Other things that they use, there are so many other things that they can use to help depression or to treat depression, like sometimes besides medication they can recommend exercise, because we know that when we exercise, our body releases endorphins that helps improve our mood, elevate our mood, and also they have other things like they use like deep brain stimulation therapy, like they can use for patients, and also electroconvulsive therapy. If medications and nothing else works, and we feel that this patient is in imminent risk of suicide, they might do electroconvulsive therapy for the patients. Please ask questions and make comments. Thank you.